The problem that we are addressing is to make sure that every child is fully immunized and they receive all the preventive health services that they need. Unfortunately, today, just 5% of children become fully immunized in the world, according to the Vaccine Alliance. And this is what we're trying to change through our work. So we want by 2030 to make sure that every child is receiving preventive health services no matter where they live. And we're trying to create the foundation, the basis and infrastructure so that different actors can unite together to make it happen. So by 2030, we want to reach a day when no child dies or suffers from preventable diseases. I was in Uganda in 2012, and I was at the health center, and there was a woman who came with her child and 2 more children. And the nurse told her that there were no vaccines and that she should come next month or something like that. And that mother, at that moment, she just stood there and she was just about to cry because she was walking for a long time to get to the health center. And she was just sitting there and just, didn't know what to do with 3 children that she had. That was the moment when I realized that we should do something about this. We should no longer see this kind of situations that happens every day in many parts of the world. If we take concretely, we are addressing 3 problems in order to reach this vision. The first problem that we are addressing is to make sure that every child is registered as soon as they are born, no matter if it is at the health center level or if it's at home. The second problem that we are addressing is to make sure that health workers are equipped with the right tools and we eliminate administration and reporting from their work so that they can focus much more on the children and to deliver health services to children. The third problem we're addressing is that we're generating through our system, My Child system, indicators that will help to identify the gaps so that different key actors, locally as well as globally, can close those gaps. So those are 3 problems that we are addressing, or we are bringing 3 big values to reach our vision. We have started Shifo in June 2013, and we have began implementing My Child system in the first clinics in Uganda in January 2014. And since January 2014 and up to now, we have been able to implement My Child system in 48 health service delivery points, and up to now, we have been able to register and follow up on more than 50,000 newborn children, and out of those 50,000 newborn children, we have been able to follow up to make sure that more than 10,000 children have been fully immunized, just in 2 districts in Uganda. We have at Shifo Vision 2030, which is very well aligned with the Sustainable Development Goals, and it's very simple. It's a day when no child dies or suffers from preventable diseases.